Hi, I'm Alex Metricardi, Chief Marketing and Public Relations Officer at Living Branches. This is being filmed on Friday, April 3rd, and I'm here today with Edward Brubaker, President and CEO for Living Branches, and he's going to answer some questions that we've been receiving from residents. Hi, Ed.
Hi, Alex. Good to be with you today.
Thanks for doing this. So first, let me ask you, how is Living Branches preparing for coronavirus?
Well, Alex, one of the ways that we're preparing and have been preparing for coronavirus is probably almost 4 weeks ago now, we set up a task force, and we originally called it the Communications Task Force, but quickly changed that to the Coronavirus Task Force because we quickly recognized that this was a challenge. And so we set up this group of, it is now 10 persons. Yourself and myself are on it. Bruce Alder is the person who is chairing that committee and coordinating things. He is our chief risk officer. Dr. Dan Hamowitz is our medical director. Kathy Schott, our human resources officer. Lori Borglum, who's our director of risk and compliance. Mary Sheeran is on. She is our infection control nurse. Monique Cole, executive director for Souderton and the Willows. Nancy Donnelly, executive director for Doc Woods, and Steve Myers, the CFO, round out that group. And so we pulled that group together. We are meeting now 3 times a week, 2 to 3 hours during those meetings, taking care of so many details. But that was the group where the agreement to start with no visitation policies on our campuses just a few weeks ago. I think that was about 3 weeks ago now. So we're doing a lot of things to try to remind people what to do. But as you can imagine, there's so many details to pay attention to. And while this group doesn't do all the details, they're the ones facilitating the Living Branches response. And so most of the things you see coming out from Living Branches originated in that response team.
Ed, you have a lot of connections with other retirement communities. Can you tell us a little bit about what's going on in other communities?
Yes, we have connections through our state association, through our national association, but also through Mennonite Health Services and also APG, Anabaptist Providers Group. And I would say the Anabaptist Providers Group, which is a group of facilities from central PA to eastern Pennsylvania. I think there's about 14 or 15 total in that group. That is probably where we get most of our information about what's happening at other places. And through that, we discovered that there are 4 facilities within that group in Lancaster now who have either positive COVID tested residents or staff members. And so one facility in particular had quite a few, I think over a short period of time, had 12 residents who were tested positive. And so we're trying to learn from them to what would happen if we would have a COVID positive resident or staff member, which we currently do not, but that may well happen to us as well.
I know you don't have a crystal ball, but one of the questions that I've heard from residents is, how long is this going to last?
Wow, you are right, Alex. I do not have a crystal ball, and I really don't know how long it will last. But I do know that through the end of April, we need to pay attention to social distancing guidelines, and we really need to work hard at making sure that we stay on campus, stay in our units, stay in our homes. Very, very important. What I have been hearing from physicians in the area or people in the hospitals in the area, that they anticipate probably in the next 2 to 3 weeks might become a peak area of concern for us as you think about how the virus has exploded in other parts of the country. And so they would see this next 2 to 3 week period of time as being very critical and a time that we really need to stay disciplined with what we're doing. I don't believe it's going to be anywhere close to being over in the next 2 to 3 weeks, but it just means that we need to be disciplined and hunker down and make sure we are paying attention to the guidelines being put out by the federal government, the state government, Montgomery County Department of Health, the Pennsylvania Department of Health, all those various places. I think it's going to change our life for a period of time after this all is behind us as well, because people will be remembering how easily things can be transmitted. But we really, over these next 2 to 3 weeks, need to be disciplined with our social distancing, with staying at home, being very careful in that regard.
One question people ask me a lot is, as residents, what can we do to make sure we're staying safe?
I think one of the main things that residents can do to stay safe is really stay in your units as much as possible and limit your contact with the outside world beyond your campus to as few interactions as possible. And really, probably grocery shopping and getting medications at a drugstore. If you don't have the wherewithal to have someone else get that for you, those are probably the few trips that are really even advisable. And even when you do that, wipe off the shopping cart handles. Be very aware of social distancing in the stores. You really don't know whether you're a transmitter or whether the persons around you are. And so it's very important to maintain good social distancing in that regard. I read an article the other day, and I would say a lot of us are doers. We like to be productive. What can I do? How can I help? And so during these times when we're just sitting at home, binge watching Netflix or whatever we're doing, reading books, praying, meditating, whatever thing, it may feel like we're not doing enough. But I would suggest that by staying at home, by keeping social distance, that's our job right now for those of us who don't have other responsibilities to come into work. And so it is an important thing that we're doing right at this moment in time to pay attention to those things, be very disciplined about that.
It certainly makes sense that residents need to stay on campus as much as possible. I've also gotten questions from residents as to how much they should be interacting with other residents. And the big hot topic of discussion is, should residents be playing cards with each other?
Wow, that's a good question and a hard question. And the reason it's hard is because we want to maintain connections with each other during these times. The problem with playing cards is this: most people are not maintaining social distances, appropriate social distances, while playing cards. And so they recommend 6 feet, which the easy way to think about 6 feet is stretch out your arm and the other person stretch out theirs, and that's around 6 feet. I would venture to say if you're playing around a table, you're not maintaining that distance. So that would mean the answer is no, you shouldn't be doing that. I also heard on the radio or the news or whatever that people say we are not a communist dictatorship in this country. And so we're not going to get the military dragging you out of your homes to make you behave. So while I say what needs to happen, we're not going to come in with the police force and determine, are you playing cards? Are you maintaining social distance? But I think another way to think about it is, if you're still going out to the grocery store and you come into contact with someone who may have COVID-19, you could bring it back here. There is that possibility. And do you want to be the one spreading that to your neighbor? And so it's really important for all of us to do everything we can to stay healthy at this point in time. I know it's very, very hard. For us, my wife Lucy and I, we've had a lot of Zoom calls and Zoom conferences. And so we do that with other couples, other friends, Sunday school class or whatever. And you can play games over Zoom. Maybe not as easily play card games, but there are things you can do. And we played various things, kind of off Who Wants to Be a Millionaire or whatever. I mean, there's ways you can find creative ways to do this. And I know it's hard, but if you can find ways to keep that social distance, and you may need to avoid some of those things that are enjoyable for you, for the good of yourself, the good of your neighbor, and the good of the wider community.
That brings up an excellent point. I do have residents asking, what can we do to help?
Yeah, and that's a good question. And I was on a call the other day that the question was asked, what do you need? And as I reflected on that, I felt we really have what we need as far as expertise. I don't want for that. We have all kinds of people who can give us feedback on what we're doing. We have a great team working at this. Staff are working incredibly hard. And so my mind went in that area. So I settled back on, well, what do we need? We need people praying for the organization, praying for our staff, praying for our residents, and really just enveloping this organization in prayer so that we can all remain calm and work with each other well, and that we can get through this, because we will be able to get through this. But another practical way that you can get involved, as of tomorrow, April the 4th, we are going to Masks for All for our employee group. It's very important for those persons coming in and out of the building, and we feel that it's time to go in that direction. The government recommendations seemingly are continuing to morph a bit, and we want to go in that direction too. So we're going to universal masking as of Saturday, April the 4th. Some of those masks will be cloth masks that can be either machine-made in a factory or homemade. And so that is an area that residents could help. If you're a seamstress or have some of those skills, that is a practical way that you can tangibly support. And Lynn Alabach, who is our Director of Volunteers, is the person that is coordinating that effort.
Is there anything else we should know?
Anything else we should know? I guess the main thing that we should know is we will eventually get through this. As I reflect on what we're going through and the 1918 flu pandemic, World War I, World War II, Vietnam, there were so many things that we went through as a country, 9/11, that felt so incredibly difficult at that moment in time. But we will persevere. We will eventually get through this. And so I am confident of that. But it's not going to be easy. It's going to require discipline of all of us. And we are going to need to be resilient and act with fortitude to get through this. But we will eventually be on the other side of that. I'm confident. We have a great team of staff. We have wonderful residents, and we will be able to get through this. I read something about the Stockton effect, and they talked about that being, and these were prisoner of war in Vietnam that may have been in solitary confinement, I think some of them up to 7 years. I can hardly imagine. We complain about 14 days, 7 years. And they found that the persons who had a mixture of realism and hope were the ones that got through it. Those persons who were realistic but hopeful, the optimists, were the ones that didn't make it. And the reason for that is they kept saying, I'll be done by April. I'll be done by January, or whatever those dates would be. And those dates would come and go, and they were still a prisoner of war. And so their optimism didn't get the answer for them. But those persons who were realistic and resilient, but also had a sense of hope that I will be able to get through this, we will be able to get through this. Those were the persons that were able to persevere. And so that's what we really want to key in on here, I think, is resiliency and hope for the future, but recognizing that in the near term, this is hard.